Good day, everybody. My name is Suzanne Gelderblom. I'm one of the psychologists at Stabilis Treatment Center. And today I'm going to discuss a topic with you which we are often confronted with at Stabilis, in the sense that we often get phone calls to book a patient, but one of the questions that we often get asked is, what is the success rate of your treatment? So what I'd like to discuss today is what makes rehabilitation successful and what will enable you to have a successful recovery. First point that I'd like to discuss in this regard is motivation. I think it is very important that your motivation needs to be in place. If you are going to be forced to come for treatment and you yourself still don't believe that you have a problem with substances, then a lot of the work during your rehabilitation will go into trying to convince you that you actually do have a problem. Whilst compared to the person coming in for treatment that has already acknowledged that they have developed a problem with a substance, and that's willing and motivated to work on that problem and to try and fix the problem, the work is going to be so much easier, and there will be a natural flow in the process of recovery. So your motivation needs to be in place. You need to be wanting sobriety, and need to be willing to do whatever it takes to eventually become sober and to learn how to maintain sobriety. Second point is willingness. Your willingness to undergo what the facility or the treatment will provide during your stay in rehabilitation. So at Stabilis, the cornerstone of our treatment is group therapy. And a lot of people, when they are admitted, they sort of become anxious when you mention the word group therapy, because they've got a certain preconceived idea about what group therapy entails. And yes, it does entail a lot of emotional discomfort. So you need to be willing to undergo that emotional discomfort. You need to be willing to let go of your pride and become vulnerable to the extent where you actually admit to certain things that you may have done wrong, decisions that you have made, people that you may have hurt, etc. Third point that is important in your rehabilitation and your recovery is that you need to be open to influence. What I mean with that is that it is quite important that when you enter a therapeutic process, and especially in this regard, the group therapy, that you will get specific ideas, specific beliefs, systems, thoughts, and in between all of that, you need to figure out and decide what is going to work for you, because we are all unique and we are all individuals. But if you're going to be walking into your group therapy or your individual therapy with a specific mindset, and you're going to say, but I'm going to stay stuck in this mindset, and I'm not willing to change or to look at things in a different way, then the possibility that there may not be growth during your program is huge. So you need to be willing to be influenced in other ways of thinking, of reacting, of behaving, and try that and see whether it's going to work for you or not. Number 4, engagement and participation. For me, this is quite important, although especially when we think of group therapy, it's not everybody's cup of tea. I know that, in the sense that there's some people that don't feel comfortable in sharing or engaging, or even in interacting. And group therapy is an interactive process. It's not necessarily one where you have a facilitator like a psychologist or a social worker that presents something. We want your interaction, we want your engagement, we want to hear what are your thoughts on certain aspects and ideas. Um, and it really needs to be an interactive process. And the more that you engage, the more you are going to grow and learn from the process. So the participation, and if your participation begins and ends with just being present at least, then that is good enough. But you need to be willing to be there and to be present. Number 5, the ability to sit with emotional discomfort. Um, it's a well-known fact, I think, that therapy and the growth that we do in therapy is not necessarily a comfortable process, especially when we think in regards of substance abuse, because substance abuse very often goes along with wanting to escape the emotional discomforts of life, wanting to not necessarily deal with emotional demands or emotional difficulties, but to escape it or to avoid it. And when you enter a therapeutic process, specifically at Stabilis, with regards to your group sessions, group therapy, and your individual sessions, you will probably be confronted with a lot of aspects that's going to leave you feeling uncomfortable. But that is where your growth will take place. So if you're going to kick against that process and you're going to constantly want to feel better and want to not sit with, for instance, withdrawal symptoms because you can't handle it or you can't take it, and you want the therapist or the nurse to fix it for you with a pill or whatever, then the process is going to be difficult for you, because then you're not willing and you believe that you don't have the ability to actually sit with that discomfort that you need to go through in order to grow. Number 6, doing the work. There's a lot of work that goes into rehabilitation, not necessarily work from the professional, but work from the person that enters the rehabilitation process. So firstly, it goes along with going through a physical detox, which again goes along with a lot of physical discomfort. We do, however, provide the patients with a withdrawal regime, medication that assists and supports the detox process and helps them to not have severe withdrawal symptoms. Then you enter the therapeutic process, where there's a lot of work and a lot of things that is discussed that will leave you uncomfortable. For instance, as an example, what the impact and effect of your substance abuse was on your family. I've seen so many times, the reaction of our patients when we start discussing this. For some of them, it's a shock. For some of them, they get emotional. Others gets angry because during the time that they were abusing the substance, they may not have been aware of the impact it had on the people in their lives, and specifically their significant others. So you need to know that this is a program that I'm going to start, and I need to finish it, but it is not going to be a comfortable process. So you need to be willing to do that work. Lastly, your maintenance. As with everything in life that requires maintenance, whether it's your home, your car, your physical health, no matter what, you can't expect to do the work therapeutically on your substance dependency once in a lifetime. There is going to be more maintenance needed. If we think of our homes, we need to maintain it on a daily basis. We need to make sure it's clean. We need to make sure that the dishes are done, the washing is done, etc. Same goes for your emotional and therapeutic health, um, as as well as your sobriety. You can't expect that the 3-week program at Stabilis will fix everything for the rest of your life. Maintenance is required. And what is maintenance? Maintenance would be abstaining from the substance, firstly. Secondly, what do I need to do in order to make it possible for me to abstain from the substance? So that would include your follow-up sessions that you get at Stabilis. That would include your support group meetings, identifying a support group in your personal environment, whether it be your spouse, your parents, siblings, friends. Um, that's also very important. People that you can actually trust and that you can go to whenever you are in need of support, because there's nobody that can guarantee you that after treatment life is going to be bliss and there's not going to be ups and downs. We all know that that is what life is about, is that you're going to be having challenges on a regular basis. And when that challenge comes along, you need to be able to say, you know what, whether I am able to do this now, or whether I feel it's fair, or whether I deserve this. This is my reality and I need to deal with it. How can I deal with it? Let me go and seek support. Let me go for my follow-up sessions with my therapist. Let me go to support group meeting. There I will find people that may have probably have gone through a similar type of experience. They have dealt with it and they will be able to also give me another perspective on how to possibly deal with it. So maintenance is of utmost importance. So those are the 7 aspects that I believe is important in order to achieve a successful rehabilitation, and after that also successful recovery. For those of you listening today, thank you for listening, and I hope that these tips and ideas will assist you in your recovery and in the maintenance of your sobriety. Thank you for listening. Goodbye.